Was being discussed since morning continuously, and most of the points have been discussed. So we're just touching upon bare Mtp Act, which is on 1971. And I was the committee member also during Dr. Shamal Seth's time. So I would like to acknowledge him also. Why was this Mtp Act made? The whole ruckus of this Mtp Act started in 1964 when they wanted to regulate the MTP and give some guidelines for the MTP. So this Shantilal Shah and committee was formed in 1964. And the committee then laid down all the rules and regulations, and thus after the whole work of the committee report, the Act was formulated in 1971 and came into existence by 1972. And the rules for the Act were formed by the government in 1975, and the regulations were framed after that by each sector of each states. An amendment of this Act later on occurred in 2002. As the years passed by, the things do change, so the amendment was required also. Recent guidelines, National CAC guidelines of 2010 were updated by 2014 again. The MTP rules were amended by 2003 and MTP regulations by 2003, which were applicable to all union territories also. The flow of the topics today would be salient features of the MTP Act we would talk upon, the salient features of MTP rules, and the salient features of MTP regulations, where all the regulations are there and who all can do it, and what all are the documentations, the penalties for the violation of the MTP Act, and the comparative objectives of PCPNDT and the MTP Act basically. The MTP Act of 1971, amended in 2002, is passed in both the houses of the Parliament and receives assent by the President. The rules are made by the central government and passed by the Parliament after the official notified gazette is released, whereas the regulations are made by the state government and passed by the state legislative councils. Here we're going to address who means a person, where means always a place, why means all the indications of the MTP Act, why we are going to do it, when means basically the stage of the pregnancy to which we are addressing the MTP. And who can do it is registered medical practitioner, which is the RMP. RMP is defined as one who possesses a recognized medical qualification as defined in Clause H of Section 2 of Indian Medical Council Act of 1956. Those whose name have been entered in the state medical registers. And who all can do it is, we'll deal one by one. Those people who have been registered before the Act which was formed in 1971 must have the experience in OB-GYN practice for not less than 3 years. And people who have been registered after 1971, if she has completed 6 months of housemanship or surgeonship in OB-GYN, or if he or she has experience at any hospital for a period of not less than 1 year in the practice of OB-GYN, or if he or she has assisted an RMP in the performance of 25 cases of medical termination of pregnancy, of which at least 5 are done independently in an established hospital or training institute approved for this purpose by the government. The training allows MTP up to 12 weeks only for these trainees, and also a postgraduate degree or diploma holder in OB-GYN who has registered with the state medical registrar office also can do it. Now coming down to where, which is a place where we have to do it. It is mandatory that the MTP should be performed at a place that is recognized by the state government. Hospital registration, like the clinic registration or the hospital registration, is not enough. MTP per se registration is required and mandatory. Approvals for the place is to be applied in the form A of the application form and addressed to the Chief Medical Officer of the district. Certificate of approval from the CMO's office, we get it in the form B, to be issued within 2 months of inspection, ideally. The certificate of approval has to be compulsorily displayed at a place which is easily visible to the person visiting your clinic. Ideally, it needs to be present in the reception area. The minimum requirement and the amendments which are done. In case of first trimester, that is up to 12 weeks of pregnancy, a gynecological examination table is required. The requirements for it would be resuscitation and sterilization equipment needs to be there. The drugs and the parenteral fluid and the crash cart, emergency crash cart is required. Backup facilities for the treatment of shock and facilities for transportation are required. In case of a second trimester abortion up to 20 weeks, which is allowed not beyond 20 weeks till date, an operation table and an instrument for performing abdominal or gynecological surgeries, anesthetic equipment, resuscitation equipment and sterilization equipments are required. Drugs and parenteral fluid for emergency use, blood bank certification for your setup is required, and the facilities for transportation. The consent forms, ideally the consent forms have to be taken in 2 parts. That is form C part 1, which is when the patient is above 18 years and not under any pressure to get a termination to be done. It is not to be against the morally or public policy of the female feticide. Proxy consent, if the patient is less than 18 years, the consent can be given by the guardian or the family, the parents need to be there. Or if the patient is mentally ill, then also the parents are, the guardian can give the consent. Form C, consent of C rule number 9 is mandatory to take a consent of a patient. If the patient is major, then the consent has to be given by the patient themselves. If the patient is minor or mentally ill, the parent or the guardian can give the consent. Legally, the husband's consent is not necessary. We cannot ask for the husband's consent for a medical termination of pregnancy. According to Maharashtra government, K-19 of 22nd November 2000, it is illegal to insist on signature of the husband for an Mtp Act. Notification and extraordinary official gadgets, which are on 18th June 2003, the amendment of Section 2 was done. In Section 2 of Mtp Act 34 of 1971, referred to as the Principal Act, which was the original act, the clause which were changed were the clause for the word lunatic, that is mentally ill person, was substituted. The clause B in a new clause will be followed, that is mentally ill person means a person who is in need of treatment by reason of any mental disorder other than the mental retardation. That person can be called as mentally ill. When can the pregnancy be terminated? Provided in Section 3 of subsection 2 of Mtp Act. Up to 12 weeks, the consent of single medical practitioner is enough, whereas up till 12 to 20 weeks, we need to have a consent to be taken by 2 practitioners for the termination of the pregnancy, as we all know. Government of India allows the use of medical agents for the termination of pregnancy up to medical termination up to 7 weeks of gestation or 49 days of last menstrual period. Mtp Amendment Act 2002 is also there for medical termination of pregnancy, as we've discussed at length before lunch. The Section 5 of Mtp Rule number 2003, it was done. About medical termination, can we prescribe the drugs at a place which is not registered under the Mtp Act? Yes, we can, but we need to have a certification from the hospital, the other hospital where we are going to take our patients if any problem occurs. The registered medical practitioner under the Mtp Act can prescribe the drugs at his or her clinic, provided he or she has access to a place approved for the medical termination of pregnancy under the MTP Act, such registered medical practitioner must display a certificate to his effect from the owner of the approved place. Thus, the clinic per se doesn't require any approval. Coming down to the take-home messages, the person, place have to be registered. The consent to be taken in Form C. Form I is a must and to be filled properly. This is the consent of the C form which needs to be filled. The I is the opinion form which is required by the RMP, and the monthly reporting form of Form 2 which needs to be done and submitted. And we need to maintain an admission register with this 14 points of references in detail, and has to be kept preserved properly. Thank you.